To the Lunch and Learn on streaming clinical workflows in Gentu. Thank you all for joining us. I would like to begin by acknowledging the traditional custodians of the land on which we stand. Here in Brisbane, this is the Turrbal people and the Yagara people. I also pay my respects to elders past, present, and emerging. I'm Tricia Fitzgerald, and I'm one of the installation and training consultants based in Brisbane. Today, we are going to look at how you can use the feature in Gentu to streamline some of your clinical workflows. There have been some exciting new features developed from the voice of customer feedback that you may not have tried out yet. We'll start off exploring the procedure and quote templates, then look at how to use both the consult and procedure notes. We'll take a dive into the process folder functionality, then look at the most recent updates in the Gentu Mobile App. Following that, I'll be joined by Olivia McCarthy, our National Training Manager, and Eden Howard, our Senior Product Manager of Gentu, to co-host the Q&A. If you have any questions throughout this presentation, please add them to the Q&A box at the bottom of the screen, and we'll try and get through as many as we can. Procedure templates are one of the most requested features, especially for practices looking to moving from Genie to the cloud. So why are they so critical to so many practices? There are two main reasons. They drastically cut down on the data required for common procedures, and they ensure that no matter who in the practice is booking the procedure, the information like procedure name, billing items are standard across all of the procedures that are taking place. To add and create a procedure template, navigate to Settings, select Templates and Procedure Templates. To add a new template, simply click the Add button. From here, simply add the template name, enter any information into the fields as you would when creating a new procedure. This is really ideal for those commonly booked procedures. Once you have added the required information to your procedure template, click the Save. One highly requested Gentu change from the voice of customer feedback that is now available is the ability to set up and customize multiple quote templates. So what are the benefits of multiple quote templates? It allows for multi-provider practices to have different letterheads set for each provider. It allows for different quotes depending on the patient type. For example, those insured, uninsured, or work cover claims. Multiple templates also allows you to set different terms and conditions depending on your procedure type. For example, you may have one quote for a procedure that is paid by the health fund and only a small patient gap, and a different template for procedures that don't attract a health fund rebate and need to be paid in full prior to the booking. Let's now have a look at how we can set up these quote templates. Just like your letter and invoice templates, this is found in the setting area of Gentu by selecting quote templates from the left-hand side. Once you add a new template, fill in the name at the top and click the letterhead area to choose your desired letterhead from your letterhead template list. From the right-hand drop-down box, simply select the estimate of fees to be formatted. Then free text any terms and conditions, payment details, or any other information you would like to print. While you can't edit the grey area in a quote, you can choose between 3 different formats depending on what is most suitable for each quote template. The first option displays the fee, rebate, and estimate patient gap with the patient gap in bold. Now, these are best suited for known gap quotes where you're asking the patient to pay for the patient gap amount and claiming the rest from the health fund. The second option displays the fee, rebate, and patient gap, but the total is in bold. This is best for quotes where the patient is likely to receive some rebate, but you would like them to pay in full and claim on their behalf, or give them a receipt so they can claim manually. The final option is to display the fee only with the total in bold. This is designed for those times that you want to display the patient gap estimate and would like the patient to discuss this with the health fund themselves. This can also be used for quoting for uninsured patients or when a procedure doesn't qualify for a Medicare rebate. For example, those international insurance claims. When you create your quote, you'll see that there is now a drop-down option that allows you to select which template you'd like to use. As part of the work on quote templates, there is also the added option under the account type to select Other, to choose those existing work cover claims or for the times your quote is required for a work cover or third-party approval prior to surgery. As you know, consult notes are a vital part of recording clinical details for patients, and in Gentu, we've developed a couple of features to help make these more customizable for different consult workflows, while still being easy to use. Let's take a look at some ways that we can customize your consult notes. By default, Gentu will display reasons of encounter, history, examination, and plan. These fields can be customized to suit your workflow by adding or removing those designated fields, or by adding your own personalized consult text field and selecting the small cog icon on the right-hand side. Text shortcuts has drastically saved clinicians time and efficiency with their clinical workflow, allowing them to create abbreviations or frequently used terms and sentences. When you place your cursor in the text box of a consult note, you'll notice that the option to configure text expander pops up at the bottom of the box. Once you have selected the text hyperlink, this will open the text shortcut preference where you can add your new shortcut using the Add Shortcut button. Enter your abbreviation, making sure that this isn't a common word that you would use as part of your consult note. Then enter in a sentence or paragraph into the phrase box and click Save. Once your abbreviation is set up, these can be used in your consult note text boxes. Some examples of what you could use this for include common medical terminology, sentences or paragraphs that commonly type in, or a checklist such as a short questionnaire that you need answered later, allowing you to streamline your consult notes to suit your practice. Do you need the consult note on the go? That's not a problem. You can also add them through the mobile app using the same template that you would in your consulting rooms. Simply select the appointment and clicking on the appointment icon. From here, you'll then have the ability to attach images to the patient file and also utilize those shortcuts. If you're a voice user, you'll see that the microphone icon next to each field, simply press this to start dictating directly using the voice. Once you are happy with your consultation note, click the Upload button to upload directly into Gentu. On the procedure screen, you'll see that adding a new procedure, there are two panels, Procedure Notes and Pre-op Notes. On the left of the procedure window under the booking details is where you will record any internal procedure notes. These notes will then be visible as part of your procedure booking and located in your appointment book. These are really useful for any internal notes needed for admin staff or general patient information. On the right side, you have your pre-op notes. These will print out on a theatre list or sent via your e-bookings. These are very important for any pre-op notes that may be relevant to the patient's procedure and need to be submitted to the hospital. Previously in Gentu, documents had to be uploaded directly to each patient record through the Add Attach button. But with these new changes, we have added the process folder. The process folder is located under the Results and Letters tab and allows you to upload, link, and process files to a patient record in bulk. And this can be up to 100 files, saving you time and eliminates the hassle of searching and opening for individual patient records. To upload files into the process folder, select the Upload File button at the top of the screen. Then either browse your files or simply drag and drop them from another open window. Once you have added your files, you can then edit the date, file name, or category of each document. You can then tick this and select all relevant documents for a patient and then select Link Patient. There is also the ability to create a note for an attachment or to add a task. Perfect if a clinician wants to use this folder to review documents, make notes, or send urgent messages to admin staff prior to linking. Once the attachments are ready to move to the patient's file, press the Process File button, and any documents that are linked to the patient file will be moved from the process folder and straight into the clinical record. If no patients are linked, then the file will remain in the process file and be actioned later. Finally, if you haven't got the latest version of the Gentu mobile app, you are missing out on the ongoing efficiency gains that this will give you with the latest new features. With the latest release of the Gentu mobile app, we have worked really hard to improve the ongoing efficiency workflow and the ability to add and create new patient records. You can now add and review your notes, and you can also view multiple practitioner appointment books and generate tasks all at your fingertips. For when you receive those referral calls or emails from other providers or drop in to visit emergency cases in the hospital, you can now view your appointments directly in the app. To add a new patient, simply select the green plus icon in the bottom of the right screen and choose Add Patient. With the latest update, you can upload photos to the patient's chart along with any op notes and any other information directly to their record. You can create, edit notes for documents in a patient's clinical history, including consult notes, procedures, attachments, diagnostic reports, and correspondence. This eliminating the need to email or update patient's file when you're back in your practice. Click the green plus icon in the bottom of the screen from the clinical history area and then select Add Note. You now have the ability to access and view all appointment books for your practice. Previously, you could only access the logged in users' appointments. But with this limitation gone, it is now easier and more efficient for your on-the-go needs. From your appointment book screen, click the drop-down menu and select the provider from the list. Adding tasks is easy. So even if you're not in your rooms, you can create a task on the go. You can create a task from the appointment card or patient file. Select the 3 dots on the right of the screen and click the task. If you can't access any of these new features that we've discussed today, or you may be a beta user, you will need to uninstall the app that you currently have and reinstall the latest version on the Android Play Store or the iOS App Store. Thank you so much for joining us today for the main presentation. If you have any more questions on these features or any other part of Gentu, we have a number of ways that you are able to reach us for more information, training, or support. We'll send out the links and the related knowledge base articles that we have touched base on today, along with the recording in the next couple of days for more in-depth information. However, if you need any further assistance, you can reach out to our support team via our live chat to get those quick answers, or submit a web form for more in-depth questions. And for anything urgent, please call our support line. Our next Gentu Lunch and Learn will be in August, but if you would like to book a personalised training session, you can submit a tailored learning request to one of our experienced trainers to assist you either remotely or at your practice. That's all from me. I hope everyone enjoyed their session today and enjoy the rest of your week and learned something new.